Hello, in this video we will discuss about the gestational diabetes, GDM. Basically it is look like a type 2 diabetes mellitus 2. And basically first of all we will understand about the normal function and normal mechanism for the fetus feed the glucose. And let's begin to understand. Here is the carbohydrate. These carbohydrates contain a sugar. When these carbohydrates, pregnant lady will eat this and go into the blood stream, so the blood glucose level will be high. So here is the placenta, which that is placenta formation, and upper part is the black color is showing the uterus, and the inside is the amniotic fluid surrounded by the amnion, while the chorion is the upper layer, and the cervix and vagina look like this. When increase the blood glucose level into the blood is known as the hyperglycemia. So the hyperglycemia will stimulate the pancreas to produce the insulin from the beta cell. After the production of insulin from the beta cell move into the blood circulatory system. So after the blood circulatory system, the movement of insulin will lead to absorb the glucose into the body of the pregnant woman. So in this way, here is the insulin will bind with the tissue, with the cells, with the insulin receptor of the female, and after the binding to open the GLUT4 channel to enter the glucose inside for the glycogenesis or glycolysis to produce ATP. But in this is the normal function, and the blood glucose drop, so the hypoglycemia can be occur. And in this way, basically the fetal development is very important for the also giving the glucose to the baby, so the food intake will be increased. While here is you can see that is the normal growth for the fetus is important for the insulin receptor increase in the cell of the fetus for increase the energy as well as the glycogen formation, and the glucose uptake will be increased for the growth and development. So that is why the insulin receptor will be increased of the fetal cell. So the fetal cell will increase the receptor. It means the insulin sensitivity will be increased, while the insulin sensitivity will be decreased in the young woman. And in this case, for example, the old woman will decrease the insulin sensitivity naturally. But in the case here of this is the GDM situation. So here is the glucose. This glucose will be intake the gestational diabetes in the form of gestational diabetes. So hyperglycemia will be occur. So the insulin resistance will be occur. In this way you can understand as well the insulin receptor will be dysfunction. So during the dysfunction of the insulin receptor is also the normal function in the normal mechanism for feeding more glucose into the fetus. But in this case here is the more dysfunction of the insulin. So here is the glucose hyperglycemia will stimulate the pancreas to produce insulin, and this insulin will bind more into the fetal insulin receptor, while the insulin resistance will be occur due to the insulin receptor conformational change. So the changes of their structure will lead to not bind the insulin with this receptor of the female. So that is why the age wise it will be increased the dysfunction of the insulin receptor. It is look like a diabetes mellitus 2. So in this way here is you can see the fetus cell uptake more due to the insulin resistance of the female to uptake more insulin for the open the GLUT channel to use the energy, to use the glucose. So in this way the fetus will use more glucose as compared to the female, as compared to the maternal cell glucose will not more as compared to the fetus. So the uptake more glucose, and in this case the enlargement fetus polyuria will be occur, and amniotic fluid increase due to the polyuria, and the glucoseuria will be increased. So the glucose will be more excrete from the urinary system of the fetus. While here is the inside, the female is also the polyuria situation, and the glucose urea will be also. So the polyuria and glucose urea is the interconnected to each other, and the polyphagia will be occur due to the loss of glucose. And polydipsia is also occur. Dipsia means the water intake due to the loss of water from the female. So in this way here you can see this is the conformational changes will increase the fetus cell uptake, insulin receptor will more work of the fetus, so that is why the glucose will uptake more. So here is you can see the sign and symptom of the female during the gestational diabetes mellitus. Uh, will the fatigue, weakness, weight loss, and high blood pressure and high blood glucose, hyperglycemia. And on the other hand, if we will discuss about the risk factors, so the risk factor can be obesity, which can create more insulin resistance, and family history, and polycystic ovary, and the previous GDM. So here is, let's begin to understand the maternal complication. So the maternal complication is the risk of infection, hypertension, and 50% risk type 2 diabetes, which that is the due to this diabetes mellitus, gestational diabetes mellitus will lead to increase the 50% risk type 2 diabetes. While here is the insulin related hyperglycemia will increase the hyperinsulinemia, and in this way the fetal complication can be fetal hyperglycemia, which that lead to increase the fetal hyperinsulinemia, and in this way the hyperinsulinemia will lead to increase the glucose uptake. So after the glucose uptake, it means that it will lead to macrosomia of the fetus, so the enlargement of the fetus, and on the other hand, the fetal hyperglycemia will lead to fetal osmotic diuresis and the polyhydramnios. Polyhydramnios mean the many fluid will be produced more. So on the other hand, the congenital abnormality will be occur. So this is the basically the congenital abnormalities due to the different complication. So in this way many more complication can be occur, but here I am just understanding to you with the overview. So on the other hand, here is the enlargement of the fetus will lead to open surgery, or during the birth trauma will be occur if the birth naturally, and large size is the major cause, and the delivery will produce the baby problem. In this way the congenital abnormality and respiratory disease, which can be curable, but the after birth the hypocalcemia and hyperbilirubinemia, and the childhood obesity can be occur. While in the case of pregnancy management, we can do it with the maternal management and baby management. Maternal management is the different, and baby management is the different after the delivery. So the maternal management can be the diet and blood test, exercise, medication, and this diet and blood test, which that is monitor blood glucose 5 times in a day, and the ultrasound can be checked the baby for the fetal blood flow, size, and heart rate. While in the case of here is the for baby management is the oxygen providing, and the glucose infusion through a drip, and on the other hand the calcium, which that is also provided. And after birth it can be childhood obesity and hyperbilirubinemia and hypocalcemia, as well as the respiratory disease. We can manage it with the continuously checkup. While the diagnosis can be screening at 24 to 28 week through a ultrasound, fasting blood glucose should be 5.1 millimole per liter, and if when we will provide the glucose, so the glucose supply after the meal will should be the greater when will greater the 10 millimole per liter in 1 hour, or more than 8.2 millimole per liter in 2 hours. So this value should be lower, but when this value will be occur in this way, the diagnosis look like a type T mellitus 2 is a non-pregnancy. For example, if we will diagnose the diabetes mellitus 2, so same mechanism in this way. So the 7 by 11 rule is used for it. In this way, the fasting should be 7 millimole per liter, while the random glucose level should be 11 millimole per liter. So this was the gestational diabetes GDM. So thanks for watching. Please make sure to subscribe.